Hello everybody, I am Dr. Sunanda Chava. Today I would like to talk about acanthosis nigricans. Acanthosis nigricans. It's a skin condition which is characterized by a velvety papillomatous overgrowth of the epidermis, that's epidermal hyperplasia of skin, in flexural areas or skin folds and creases like axillae, groin, inframammary region and neck. Just I would like to show you a picture of acanthosis nigricans in the axilla. I think you can see this velvety dark patch in the axilla and neck. So what are the types of acanthosis nigricans and what is its importance, dental importance? Types could be hereditary or acquired. So hereditary means it's autosomal dominant, and acquired means due to lifestyle factors or during the life they can get this because of use of some products. So acanthosis nigricans could be hereditary or acquired. So what are the causes? Exact cause is unclear, but usually it occurs in the age group below 40 years of age. It's predominantly linked to insulin resistance. It has frequently coexisted with type 2 diabetes, obesity, metabolic syndrome. What is a metabolic syndrome? Diabetes, hypertension due to smoking, obesity and all these are considered to be metabolic syndrome. Then polycystic ovary disease, PCOD and generalized lipodystrophy. Insulin excess levels bind to type 1 insulin growth factor receptor on keratinocytes. These are present in the skin and stimulate the proliferation of keratinocytes leading to acanthosis nigricans. So there is a acanthosis means usually it will be the proliferation of one layer of epidermis or epithelium. So negro means black. So acanthosis nigricans means black patch, velvety patch, thick, darkened patch. So the name, why it is given, it explains that. Other types could be due to drug related. Drug related means it could be it could be due to nicotinic acid lotion, fusidic acid ointment, subcutaneous insulin injections, oral contraceptives, oral corticosteroids, hormone use like estrogen, testosterone, and aripiprazole, some perfumes. Familial acanthosis nigricans could occur at birth or childhood of a child till puberty. Later, after achieving the puberty, it might stabilize or regress. It's due to a mutation in fibroblast growth factor receptor 3, that is FGFR3 gene. Autoimmune acanthosis nigricans. It could occur with autoimmune conditions like SLE, that is systemic lupus erythematosus, Sjogren's syndrome, scleroderma, Hashimoto's thyroiditis. We will find another type called acral acanthotic anomaly. It could occur on, it's a type of acanthosis nigricans occurring on elbows, knees, and dorsum of hands and feet. Unilateral acanthosis nigricans is another type. It occurs along Blaschko lines at any age. What are Blaschko lines? They represent pathways of epidermal cell migration and proliferation during the development of fetus. That's the development of the baby in the womb. That cells migrate from one area to another. So those pathways, those lines are called Blaschko lines. They occur along that, acanthosis nigricans. So that type, it's unilateral, means only on one side. Malignant acanthosis nigricans is paraneoplastic, so it is due to release of stimulatory growth factors by tumor cells. It's associated with gastrointestinal malignancies, gastric malignancies, squamous cell carcinoma, liver cancer, malignant melanoma, kidney tumor like Wilms tumor. So sometimes some people have tripe palm, tripe palms, that's palmar surface of the hands. These are thickened and darkened. So they can occur, 90% of these tripe palms are associated with internal malignancy. So in some cases, acanthotic nigricans could be not in some cases, in many cases of tripe palms and acanthosis, acanthosis nigricans could be associated with internal malignancy. But not all internal malignancy cases are associated with acanthosis nigricans. Clinical features of acanthotic nigricans, it usually occurs in dark-skinned individuals. They're symmetrical, thickened, brown velvety patches and plaques in intertriginous areas. They can occur in axilla, groin, neck, that is neck and back or beside neck, vulva, perineum. So it can have some macerations and then sometimes skin tags. Then malodor might be present. So what's the dental importance? It can occur in the mouth. So it can occur in the oral cavity, nose, larynx, esophagus. It can have itching, that is pruritus, and it's very common in malignant acanthotic nigricans. What is the importance of this acanthotic nigricans? Why we should worry about that is it causes lot of cosmetic disfigurement, psychological distress, and it has risk for diabetes, that's type 2 diabetes, obesity associated complications. It could be associated with internal malignancy. So if it occurs in the mouth, it might be difficult to diagnose, but if we know that particular condition called acanthosis nigricans exists, we can diagnose it, and if there is any history of, we can look out for any internal malignancy, associated malignancy. So how are we going to diagnose it? We are going to diagnose it clinically. Very rarely we use it's usually mainly diagnosed clinically. And these history, medication history, then imaging modalities and lab tests can be used to diagnose acanthotic nigricans. What is the differential diagnosis of acanthotic nigricans? Skin conditions looking like acanthotic nigricans are erythrasma. Erythro means red, asthma. So red patches well demarcated with maceration, scaling in skin folds you see. If you, under the wood slam, if you scrape the scales, you will get, and are subjected to fluorescent test, you can see coral red fluorescence which is absent in acanthotic nigricans. This is how you differentiate. It's red fluorescence what you get in case of erythrasma, that you won't find it in acanthotic nigricans. This is how that you are supposed to differentiate it when it looks similar to erythrasma. Acanthotic nigricans looking like erythrasma. Then in some cases like lichen planus healed ones and all, the post-inflammatory pigmentation can look like acanthotic nigricans that you can make out by history and biopsy. Striaficum. Confluent and reticulated papillomatosis is another condition which might mimic acanthotic nigricans. Females are involved more than males. 18 to 21 years age group is more frequently involved in case of confluent and reticulated papillomatosis. Thus, you'll have a growth, papilla. Then reticulated means lace-like. Confluent means continuous. Reticulation is heterogeneous, whereas in case of acanthotic nigricans, it is homogeneous. In confluent and reticulated papillomatosis condition, you find heterogeneous type of reticulation. That is, it's not consistent throughout. It's not homogeneous. But it is homogeneous in acanthotic nigricans. This is the differentiating feature. Intertrigo. So erythematous patches and plaques might be there. Pruritus might be there, might not be there. Tenderness might be there, might not be there. And history of symptoms you have to see. Tinea versicolor, it's a yeast infection. You have to scrape the scales and you'll have a characteristic spaghetti meatballs yeast under microscope. That can mimic acanthotic nigricans. Tinea versicolor. Treatment. Treatment could be non-pharmacological, pharmacological, surgery. So, non-pharmacological means you have to do lifestyle factor modifications, healthy eating habits, then lowering the obesity in obese individuals, doing good exercise to improve the insulin resistance. Many cases of acanthotic nigricans, there is insulin resistance. So you need to improve the insulin resistance. When there is insulin resistance, there is no glucose breakdown. There is the absorption of the glucose is it becomes there is excess glucose in the blood. You will get type 2 diabetes. Then pharmacological or metformin, rosiglitazone. So they'll reduce the insulin levels. Malignant acanthotic nigricans. Careful workout should be done in case of malignant acanthosis nigricans. Treatment of malignancy has to be done. Cyproheptadine, it will cause regression of malignant acanthotic nigricans by inhibiting the release of paraneoplastic tumor factors produced that contribute to acanthotic nigricans. Drug-related acanthotic nigricans, by withdrawal of the drug, you can control. PCOD, you can give oral contraceptives. And then you can use keratolytic agents like salicylic acid, glycolic acid, trichloroacetic acid. Then topical retinoids also can be used. Calcipatriol can be used. Omega-3 fatty acids, which are rich in fish, can be eaten. Fish oil. Then vitamin D3 intralesional injections. Podophyllin, you use it for viral warts and all. You can use that here. PUA therapy, that is Soralen ultraviolet A therapy, which is used in case of psoriasis. That also can be used for acanthotic nigricans. Dermabrasion, laser therapy, surgery. So these all are the treatment modalities of acanthosis nigricans. So in the mouth they can appear, so that could be malignant, mostly it will be malignant, so you need to be careful. Then this finishes acanthosis nigricans. Please, if you like this channel, please subscribe to my channel, share my videos and like my videos. Thank you very much. Please give the comments in the comment section. Thank you very much. Bye. See you next video.